from the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I join you from the Nation Talk offices in Toronto, and my name is Marion Crow, the Chief Executive Officer of the First Nations Health Managers Association. I am a Pie Pod princess from Pie Pod First Nation in Saskatchewan who lives in the unceded and unsurrendered territory of the Algonquin people of Ottawa. So I thank everyone who is tuning in live on all of the different platforms that we are airing on, to everyone who is listening on their radio stations. Thank you, thank you, thank you so much for welcoming us into your nations, your territories, and your homes, where you have tuned in to get reliable and credible information on COVID-19. So a huge thank you to all of those radio stations. APTN, thank you so much, and to the team at Nation Talk for making this possible. It's another edition of the virtual FNHMA Town Halls. So folks, I think you know the drill by now, but if you have a question, please send them in to fnhma@ihtoday.ca, and we'll hope to get those answered for you, if not today, on a future town hall. So as always, we have a jam-packed hour. So I hope you're settling in with some tea, maybe a bannock and bologna sandwich. I must be hungry because that's all I can think about right now. So let's get settled in, and I would love to welcome back to the FNHMA Town Hall our partner at Indigenous Services Canada, Leila Gillis. Welcome back, Leila. Come on into our discussion. Let's spill some tea today.
It's awesome. I'll have 2 sugars and some milk in my tea. So, so thank you, Marion. Again, it's such a pleasure to be invited back to share the EPI statistics with you all, and of course, the EPI or epidemiology statistics basically that I'm sharing are simply the results of the study and analysis of the distribution and the patterns of COVID-19 in Canada and specifically in First Nation populations. I'm fortunate to be joining you today from the beautiful traditional and unceded territory of the Algonquin Anishinaabe Nation from my home here in Ottawa. I'm originally from the east coast of Canada, the traditional lands of the Beothuk, the Innu, the Inuit, the Mi'kmaq, and Maliseet. And I want to acknowledge all the traditional stewards of the lands upon which all of you gather today. I'm Indigenous Services Canada's Acting Chief Nursing Officer and Director General of the Office of Primary Health Care. And I'm going to start today with sharing with you some of the current COVID-19 statistics as updated on Tuesday, March 2nd. In that time period, the number of active cases reported in First Nations on Reserve was 1,375, and that includes 336 new cases. And that's compared to more than 30,000 active cases in Canada, with nearly 2,500 of them new. And since last March, and we're nearing the 1-year mark, the total number of reported cases in First Nation communities has been over 21,000. Of which just under 20,000 are reported as recovered. This compares to nearly 873,000 cases in Canada, with just over 820,000 of those having recovered. This week's EPI report identifies that over the past year, there have been a total of 984 hospitalizations for First Nations on Reserve, of which 10 are new. And that compares with over 47,000 hospitalizations overall in Canada. And unfortunately, there have been 10 new deaths for First Nations on Reserve, and an overall total of 239 deaths for First Nations on Reserve. And overall in Canada, a total death toll of 22,000 that's attributed to COVID-19. We're cautiously optimistic about the recent drop in active cases across the country. And actually, the rate of newly reported COVID-19 cases in First Nation communities and general Canadian populations, well, in wave 2, First Nations were much higher, at a much higher rate of reported COVID-19 cases at per capita. But you know what? We're currently on par with the rest of Canada. It's come down to be sort of a more even keel, and that's good news. But we're watching closely the emerging evidence on the variants of concern. I know you focused a bit on that last week. The rate of vaccine uptake, that, we're watching those who are maybe hesitant or have some lack of confidence potentially in COVID vaccine, and assuring that we're tracking that. Along with the overall prevention fatigue experienced by all of us. All of these things can lead to significant growth in cases and subsequent hospitalizations and deaths. So although we're optimistic, we're watching all of these things closely from an epidemiology perspective. So you, and we need to continue with physical distancing, wearing masks, washing hands, and we really, really need to limit the larger social gatherings at this time. Along with and supporting these important public health protection measures is the rollout of vaccine across the country. Brighter days. And it's encouraging that since the town hall last week, that we've had a new COVID-19 vaccine on the scene in Canada. Canada has authorized 2 manufacturers for what's being called the AstraZeneca vaccine. And the 2 manufacturers are AstraZeneca COVID-19 vaccine and a second that's in collaboration with AstraZeneca, and the brand name is called Covishield. So you may have heard of that vaccine as well. AstraZeneca COVID-19 vaccine and Covishield are the same type of vaccine technology, and they're called recombinant vaccines. Another example of that type of vaccine technology would be the hepatitis B vaccine. And Health Canada has reviewed the manufacturing information for those 2 new vaccine brands and found them to be comparable. AstraZeneca is a different technology from the first 2 COVID vaccines, Pfizer and Moderna, which you may have heard of as mRNA vaccines. The new vaccine is approved for people who are 18 years of age and older. However, currently in Canada, it's not being recommended for 65 years of age or older during the, basically due to the limited information on evidence in this group at this time. With further evidence, this will likely change. As of March 2nd, nearly 119,000 vaccine doses have been administered in First Nations and Inuit communities situated in the provinces and also in Indigenous and non-Indigenous populations in the territories. And second doses are already underway in some communities. Nearly 400 First Nation communities have started vaccine clinics, and an additional 83 communities have started vaccines in the territories, Nunavik and Nunatsiavut. You've also heard some news yesterday that Canada's National Advisory Committee on Immunization has issued new guidance advising that the window between the first and second shots for all 3 of the approved vaccines, that's Pfizer, BioNTech, Moderna, and AstraZeneca, can now be considerably extended while still being effective. NACI considered evidence from recent studies on efficacy and effectiveness of COVID-19 vaccines in preventing various health outcomes such as infection, symptomatic disease for COVID, hospitalizations, and death from COVID-19. And this data showed sustained levels of protection against infection, hospitalization, and death with the first dose of the vaccine, and applying modeling and immunological principles and science support that it's not expected to see rapid waning of protection until after 4 months. So NACI recommends that in the context of the limited COVID-19 vaccine supply in Canada, jurisdictions should maximize the number of individuals benefiting from the first dose of the vaccine by extending the interval for the second dose of the vaccine to as much as 4 months. Extending the intervals can protect far more people, keep more people from needing hospitalization, and prevent more people from dying of COVID-19. Extending the dose intervals to as much as 4 months creates opportunities for protection of the entire adult population within a short time frame. And this will not only achieve protection of the adult population, but will also contribute to health equity. Extending the dose interval can elicit similar or even stronger immune response and protection, as seen in the AstraZeneca vaccine data. The extension of dosing intervals can maximize the number of Indigenous and non-Indigenous people benefiting from the first dose, and much, much faster. The more people who get at least one dose of the vaccine, the lower the anticipated risk of outbreaks, for example. And NACI will continue to monitor the evidence on effectiveness and extended dose intervals, and will undoubtedly adjust recommendations as needed. This is great and encouraging news. However, we should still remember that individuals should continue to practice recommended public health measures for prevention and control, regardless of vaccination. At this time, there's just insufficient evidence on the duration of protection and effectiveness of the COVID-19 vaccines in preventing asymptomatic infection, so carrying the virus, and of course, reducing the transmission to other people. So we don't know that the vaccine prevents that at this time. So public health measures are still super important. As I've said in previous town halls, I've been a nurse for 30 years, and I have given thousands of vaccines throughout my career. And I can't wait to have the opportunity to receive my own doses of the COVID-19 vaccine. And I always like to share that vaccines are safe, and the benefits of getting the vaccine outweighs the risk of not getting it. The pandemic has been so hard on everyone, not the least of which are frontline workers. Managing outbreaks, shutdown, isolation, and now vaccine rollout. We and they are getting so fatigued. And I want to take this opportunity to just give a special shout out to all the nurses working throughout the pandemic, and all those that are working, that they are working with in caring for us all. I just want to say, take care of yourself, get rest, eat well, take your breaks, take time for you, and seek help if you think you need someone to talk to or to get some advice from. There are so many resources out there, take advantage of them. And I feel privileged today to participate alongside Kelvin from the We Matter campaign and organization. Not only has the pandemic been hard on frontline workers, Indigenous youth face so many challenges ordinarily related to mental health, addictions, including suicide. During times like this, it's even harder, and your story is important. Your campaign as an Indigenous youth-led initiative has touched and inspired me to witness the far-reaching positive messages I've seen on social media, reminding each other to have hope, that youth deserve happy, healthy love, and that culture saves lives. I really look forward to hearing more today on your great work. So in closing, I'm going to ask that you please be cautious about what you read on social media. Some information is just inaccurate and can cause confusion and anxiety. So rely on sources you can trust. And I know you already have figured that out because you've joined the First Nation Health Managers Association Town Hall today. So it's really been a pleasure to share with you today, and I'm going to turn it back to you, Marion.
Thank you so much, Leila. And I really appreciate that you honed in on those important messages to the youth. You almost had me in tears, which happens just about every week on this broadcast because there are so many touching stories of resilience, of strength, and our healing community spirit of toughness and grit. So I do want to add to that dialogue that FNHMA also has another service that if you're looking for further credible, reliable information on COVID-19, we're going to play this commercial for you on the FNHMA Info Point service. So Chris in the studio, over to you. Created by your First Nations Health Managers Association, we introduce InfoPoint, a convenient and accessible helpful desk for First Nations health managers looking for credible sources of information on COVID-19. Don't have time to dig? Talk to a real person now at 1-855-446-2719 or email infopoint@fnhma.ca. Indigenous Health Today is another resource of information by region at ihtoday.ca. And Kathy Mitchell from Sagmuck First Nation, who is part of the FNHMA family and team member, who is waiting on standby now. If you have an email or a phone call that you want to make to InfoPoint, say hello to Kathy Mitchell when she greets you with that lovely voice when she answers that phone call. Now, let's just do a reminder. If you have a question, please email them to fnhma@ihtoday.ca. And I just want to give a special shout out. Thank you, Fred, for watching from Halifax, Nova Scotia, and Tansei, back to you as well. I hope you feel a lot of love and comfort in getting your information here on the FNHMA Town Halls. So our next guest, who I just learned is a recipient of the Governor General's Award last week. Calvin from We Matter, what an incredible job you are doing. And thank you so much to coming back, not yourself, but We Matter has been on the program before. And welcome, Calvin. Come on into the FNHMA Town Hall.
Hi there. Thanks for having me. Yeah, it's pretty exciting. I'm glad to share some information about We Matter and Indigenous youth mental health. As you mentioned, so my sister and I are honored. Her and I started this organization, We Matter, and last week we got awarded what's called the Meritorious Service Medal, which is for folks in Canada who I guess, it's from the Governor General, and it's pretty exciting. But I'm here to talk about We Matter and about Indigenous youth mental health. And so during this pandemic, as I'm sure so many folks know, mental health concerns are always something we need to worry about, but especially in these times of the pandemic where a lot of youth aren't able to go to school possibly, or aren't able to visit their friends. And there's just a whole lot of stress that I think all of us need to be thinking about how we're taking care of our own mental health, but also the mental health of, our brothers, our sisters, our children, our cousins. And I think the biggest thing that I want to share today, and I'll get a little bit into it, is that sometimes it feels like working and talking about mental health is something only for the professionals. And I think that we need to get away from that. And what I want to talk about is how everybody who's listening, every single person has the ability to talk about mental health and to support folks who maybe need a little bit of support, whether you're a parent or a cousin or a teacher or even a non-Indigenous support worker, brothers, sisters. All of us can be a part of supporting mental health for folks who need it. And We Matter has lots of fantastic resources that will make it easy for you. So that's what I'll talk about. Just to introduce, for anybody who doesn't know, so We Matter is an Indigenous youth-led national organization. It was started by myself and my sister Tanshai back in 2016. And we started it because we grew up in the Northwest Territories. I'm a member of the Dininukwe First Nation in Fort Resolution, and I grew up in Hay River, a small little town. And being Indigenous growing up, you know, and facing all of the things that youth face, there's almost, at the time, no resources that were like developed for mental health for folks like us. It would always be, you know, some mental health resources that were concocted in Ottawa or Toronto. And it just didn't fit for who we were as people. And we started We Matter as a way to try to create some of those resources. And so apologies for the light for those of you who are watching this. The sun keeps poking in and out of the clouds. But We Matter is an organization that tries to support Indigenous youth with mental health. And we have a whole bunch of different ways that we do that. We have the We Matter campaign, which is an online resource of hundreds of videos from Indigenous role models, all talking about their own experience of overcoming mental health issues. And folks who are listening can go online and watch videos from hundreds of different people who've overcome depression or bullying or addiction. And it's a little video, it'll be 2 minutes of someone, you know, like A Tribe Called Red or Don Burnstick, just talking about, hey, this is, you know, I dealt with suicide and here's how I got over it. They're really easy to watch. There's so many of them. There's from youth and that kind of thing. And they're a fantastic resource. We Matter also creates toolkits. So we create little packages, little booklets that help folks to talk about mental health in their communities. We Matter does training for Indigenous youth mentors. So once a year, we do a call out for Ambassadors of Hope, which are, it's a program for Indigenous youth 16 to 26, where we train youth to become ambassadors, to feel comfortable talking about mental health, and then we support them with resources and they go off and do presentations. And we also offer grants. So if a young person wants to start something cool in their community and they feel like that there aren't resources, that's, you can apply to us. A few times a year we do a call out. And so we actually just did a call out in January for young people who wanted to do something cool in their community, like an online talent show or a drumming workshop. And they could get up to $1,000 to do that in their community. So I'm kind of word vomiting all these different things that are possible. But I would say, again, coming back to the main point. So We Matter is designed to support Indigenous youth with mental health. And every single person who's listening has the ability to work with the young person, to sit down and talk about, you know, sadness, or to talk about anger, and how to deal with those emotions, how to deal with someone who's bullying. And it can be challenging to do that because we're afraid of saying the wrong thing. We're afraid of making it worse. But a lot of times by keeping silent, that's actually, that's the worst thing, is then youth perhaps feel like it's not okay to talk about when they're feeling sad and that kind of thing. And that's one of the biggest things that we try to do at We Matter, is help it to feel normal, that it just feels normal to like check in and say, how are we feeling today? And if I had one takeaway that I was to hope that everybody listening would do, which is we have all these fantastic resources on our website to help folks in communities to have conversations around mental health, is I would hope that anybody who's listening right now would go to our fantastic website, wemattercampaign.org, and find our toolkits and resources section, and to download our mini toolkit. So We Matter has a mini toolkit. There's one for teenagers and like folks in their 20s, and there's also one for youth younger than that, 12 and under. And I want all of you to go to wemattercampaign.org/mini toolkit and download the We Matter mini toolkit, which is a little 8-page document that can help anybody to have a conversation with a young person about sadness or loss. And during these times of COVID, doing things that bring us together, I think, is really important. And that's something that all of us can do, which is just watch videos together. Even if you are a young person that's listening, get together with your brother or your cousin and watch some of these We Matter videos that can just help us feel good, to take that little time a day to do something for ourselves, just to feel a little bit better. And so for anybody who's listening who's never heard of We Matter and doesn't know exactly what, as an organization, we're all about, I'd like to play a little video. And so the way We Matter started was with the idea that let's get hundreds of videos of Indigenous folks just talking about overcoming obstacles. Because why not? I think that's something that could be really helpful. And so we're going to play for you one of the very first We Matter videos that ever existed. So when we launched in 2016, we started with 20 videos to sort of, show what this organization is all about. And this is a video from a young teenager who's Inuk from Uluhaktuk in the Northwest Territories. And I had done a workshop in the community to talk about what we were going to do. And we asked the youth, what message would you want to share with other young people that are out there? And this is the video that this young woman wanted to share. She has cerebral palsy. She's had challenges with bullying. And I think that her voice can show how wonderful it is when we just talk about the things that we're going through. So I'm going to throw it to Chris shortly to play one of the examples of the We Matter video, of which we have hundreds of online. And you can hear for yourself how much hope and love and positivity that you can find with We Matter. So Chris, go ahead, please play the video from Sidonie Okina from Uluhaktuk in WT.
Hi, my name is Sidonie Okina, and I'm from Uluhaktuk, and I'm 17 years old, and I have cerebral palsy. So it's been a tough life. Like, I've been bullied a lot in life, and I am graduating this year, but I wouldn't be graduating if I didn't make some sacrifices. Like, I remember back when in grade 7, I was having a really difficult time with fitting in and getting along. I would go crying home every day until I finally got what was inside of me out. I finally decided to tell someone about how I felt, and it made me feel better. It made me motivated to finish school, and now here I am in grade 12, finishing off high school, and I feel really proud of myself. Like, there was times where they were really hard, but I kept telling myself that I can do it, and look where it got me, right here. My message to you guys is, like, if you're having a tough time with school or anything in life, there's always hope for tomorrow. Like, don't give up. Like, even though you're giving up, like, you're almost at that point where you fell off the edge. You wouldn't fall off. You just gotta find a way to get back up there and show the world how amazing you are, because you all matter.
Amazing, that was perfect. That was good, right? That was good.
Yeah, so that's the voice of Sidonie Okina, a young person sharing her own perspective on managing mental health. And I strongly believe that as Indigenous folks, that we have the power and the capability to heal, and that us sharing our own voices can be healing. and that we can get strength from each other. And so in the times that we ourselves are feeling low, that we wanted to create a We Matter as a resource where at any point in time, there's just 100 videos sitting on a website that you can go to just to get a little bit of a boost, and to pitch how great that this website is. If you go to wemattercampaign.org, you can find information about what our organization does. Things like when we do our grant announcements, so that if you want to apply for $1,000, it lets you know when to do that, when we have call outs for youth. You can download our free toolkits. All of our toolkits are free. So the mini toolkit, we have a mini toolkit for kids. We have a youth toolkit. We have a toolkit for teachers. We have a toolkit for support workers. And we have a videos page where you can access the 300 plus videos like Sidoni's, and you can search them. So if you want to look for videos just from Nunavut or from British Columbia, you just hit the little button that says British Columbia, and it comes up with all the British Columbia videos. Or there's a button you can hit that says addiction, and it brings up all of the videos where Indigenous folks talk about overcoming addiction. Or you can hit the loss button, or uplift, or coping strategies, where it just talks about the things you can do to overcome problems. And so I hope that anybody listening who hasn't explored the We Matter videos page is to go check it out. A good place to start is with the most viewed tag. So you can see the ones that have got the most traction, and Sidoni's is one of those. During the pandemic, it's really hard on young people. I think one of the hardest things to deal with in life is uncertainty. And there's just so much uncertainty right now. We don't know when, we could go visit our cousin, in the next town. I'm in Northwest, I'm in Vancouver now, and I don't know when I can go up home, to go duck hunting. And for students, not knowing when school is going to go back to normal. And dealing with that uncertainty is really hard. And I think that the perspective that I would recommend from the We Matter side is to try to do as many things that can bring you together. And even though maybe you can't have big groups of people, just within a family or within a household, to have it become regular, where you do things like a board game night, or doing activities on the land. Or one of the things I'll shout out to parents is to if your kid loves video games, to play with them. It's one of the things that normally you don't want to always shout out video games, but during a pandemic, it's not a bad idea to sit and play Mario Kart with your family, because it can bring you together. And going out on the land, that kind of stuff. That's the kind of stuff as We Matter that we've been trying to share with our audiences. And so We Matter has about 30,000 followers on Facebook. So folks can go find us on Facebook and follow our page. And when we get new We Matter videos, we post them there. We have a lot of mental health content, and everything that we do is just about positivity. It's about, you have the strength to get through this, that there's always hope. No matter how hard things get, and to give tools and resources so that you don't feel alone in trying to overcome some of those tough obstacles. It's been 4 years since We Matter launched, and our catalog of videos is massive. The amount of resources we have is huge. Myself and Tunchai started it, but now we have a staff of about 7 people. It keeps growing. Who are all available if you have questions about, I have a cousin who just lost their friend, what can we do? Or, I know someone who's going through addiction, and we don't have all the answers. Obviously, we're not a medical organization, but we are full of hope and strength. And all of the videos on We Matter, we want to become a regular part of life for any Indigenous young person. I believe any any teenager who's in Canada, who's Métis, First Nations, or Inuit, should watch that Sidoni video, or should watch, we have a video from Jack Jr., who's like this teenager from Attawapiskat, or the Don Burnstick video, or Ashley Collingbull. We have videos from all these amazing folks. Even Taboo from the Black Eyed Peas did a video. Jordan Tutu, the Inuk NHL hockey player. Theo Fleury, the NHL legend. All of these incredible people have done We Matter videos talking about overcoming hardship. In addition to, you know, a 13-year-old from Sandy Lake First Nation, Ontario. It's just the, you know, we all have the capability of working to overcome these obstacles. And so I recommend to you all, go to our We Matter website and download the mini toolkit. It's a little starter session on everything that We Matter has to offer, and all the videos you can watch on our website. And if you're listening on the radio and you're in a community that doesn't have good internet service and watching videos online is hard, just send us an email to info@wemattercampaign.org, or message us on Facebook. And we have USB sticks that have all the videos, and we mail them to communities that don't have strong internet. And it'll have, you know, 250 videos from Indigenous role models talking about overcoming obstacles. And we'll mail you a bunch of toolkits. And then teachers in schools can watch these videos together, or in with a counselor, or just a parent who just wants to sit with their teenager and watch a video together about how to overcome challenges in life. So We Matter, we want to be this little door you can open to get positivity whenever you need it in all sorts of different ways. Let us know what you need. But I'm so happy to talk about all this, especially during the pandemic, when it needs to be top of mind. And maybe we have the time now to think about it, whereas before with busy lives, less so. So this is a good time to get in the habit of thinking about positivity and hope and that kind of thing. So that's my little spiel. I'm happy to stick around to chat more or for questions, that kind of thing.
Calvin, you embody the messages of hope for today's youth. Thank you so much for sharing that. I do want to give you some feedback. Christine on APTN Facebook is really wanting to express her thank you for sharing that video. It makes it relatable to many other people who may suffer from that. This is demonstrating how all people matter, which is we matter, right? The collectiveness. So thank you so much. And I do just want to remind folks that we know connectivity is a challenge in some of the nations across Turtle Island. And please, 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 if you are one of those nations, send a Facebook message to We Matter and get that USB stick and share, maybe have a community viewing session. I see Calvin is holding up the booklet right now of We Matter. He's trying to show us, oh, there it is, the mini toolkit and the We Matter USB stick. There we go, another tool so that we can influence the We Matter movement and get youth engaged in having a dialogue and a step-by-step guide on why this is such an important toolkit to have in your nations. So again, a huge thank you to We Matter for doing this incredible work. We want youth tomorrow. So let's continue to give them the tools and supports so that we can see more days ahead with those hopeful messages. So Calvin, I'm just going to ask you to mute for a second. I'm going to go to the inbox and dive into some questions, but don't go away because we'll definitely have a couple of questions in there for you, Calvin. So Liala, get ready. We've got some questions for you. As always, people want to know about vaccines. We want to get into a little bit about trust. And so let's just dive right in. Again, for all of the listeners and viewers, and I know every week there's, anywhere from 2 to 20,000 people who access this town hall, and we thank you. We lift you up, we hold you up, and we are so grateful that you are getting credible and reliable information here on the FNHMA Town Halls. So Liala, what would you share with us about First Nation people that may be immune compromised and the vaccine? What are some takeaways on that, Liala, that you would like to share?
Great. Well, thanks, Marian. And I think there's lots of reasons why an individual may be immune compromised. So first and foremost, to follow up with your primary care provider, because there's many different responses to that. But I think, relative to the vaccine, you can get that advice from, depending on whatever condition you have, on whether the vaccine is advisable. I would presume in most circumstances that it is, and that you should be lining up with everyone, I think, when your time comes for vaccine access. Currently, it has been, often elderly are considered immune compromised just as a result of their age. And so as a result, they have been prioritized for vaccine. But I think on a case-by-case basis, relative to those who are maybe under some of the age groupings for prioritization, it's worth having a conversation with your primary care provider to sort of look at what your options are relative to your province and the rollout of vaccine.
Don't go too far. I'm going to move over to Calvin for his perspective. So stay with us, Liala. Again, questions to FNHMA at ihtoday.ca. Calvin, I know that it's going to be a little bit of time yet before we get to our youth vaccinations. And now with some recommendations on the new vaccines coming out for under 65, what are you hearing about the youth getting vaccinated? Are people excited? Are you going to get vaccinated, Calvin? What are your thoughts on what the youth are saying in vaccinations?
Yeah, for sure. Well, just quickly from my perspective, my parents are in the Northwest Territories, and all of NWT was prioritized because it's northern, it's harder to get services. And so both of them have the vaccine. One of my sisters, who is a support worker in the Yukon, got vaccinated. And I'm so excited to have had that happened. Because it just gives me a peace of mind. I'm kind of torn for myself, because if somehow I got offered the vaccine tomorrow, I would be, yes, please, from a health perspective, but also because, I am younger and I'm not at the risk group, then, I would maybe not take it immediately just because I would want them to prioritize older folks. But I think that for a lot of youth that it's a similar situation for other folks, where there's hesitation for some really valid reasons sometimes that they haven't been treated well by the medical system. And I think that what we try to do in conversations is to really take in people's fears and not to just dismiss it, to say no, you're wrong, it's totally safe, but to listen to folks about why is it that you're afraid of this? And then just to try to have a conversation around it. And so I think generally most youth are going to be excited to have it. For example, typically We Matter does a national gathering every year where we train our ambassadors of hope, who are our youth mentors. And we haven't been able to do that in a year. And I would love to be able to do that, to get 40 Indigenous young people from across the country to get together and train and get to know each other and go back. And we can't until that we hit whatever it is, 70%, 80% of vaccinations. And so for the sake of these youth, I would really hope that everybody out there is, really thinking about what it means to our communities to get these vaccines so that our young people can gather again. And I think that that's what a lot of youth want, is to be able to get together again. And all of us can be a part of that by, listening to the medical advice and, talking with each other to overcome our fears and to ultimately get vaccinated.
Well, I want to share with you another. I'll just get you to mute for a second, Calvin, so we don't get feedback. Thank you so much. I'm so bossy, just like a Cree boss, right? I mean, Indian woman with a podium. I do want to share with you, Calvin, that another Facebook person has sent in a message saying, thank you so much for shining your bright light on this earth for the greater good of all, but mostly for First Nation, Inuit, and Métis Indigenous peoples. This is fantastic work. Your work matters, and they are spreading love, light, and hope. Thank you so much for the person that sent that in. It is heartfelt. I can feel your love through this message. And I just want to say thank you again for chiming in on the comments and things that we are sharing here on the FNHMA Town Hall. So great bright lights. Now let's go back to the inbox, and I'm like weepy today. I'm sorry. This is just such a feel good moment, when we're talking about today's leaders and our youth ambassadors. It's just so wonderful to see that tomorrows are going to be so much better. So Leila, what about, do you know if anyone has gotten COVID twice? Is that even possible? That's one of the questions we have in the inbox for you.
I don't think I know the answer to that. But I mean, I think that it's a possibility that you may be able to get up twice, but I honestly have no idea. I don't know the answer, but we can get back to you with that one. I think whoever we send next week can bring the responses to whether there's evidence of that. But yeah, no, I think that for sure, that's something we can come back with.
Okay, and maybe Moccasin Telegraph knows as well. So hey, all you listeners and watchers, if you know that somebody's had COVID twice, share it with us and we'll get it out on the airway, because it's an important question. And I'm sorry we don't have the answer, but we will commit to coming back next week with that. Now, I do just want to say that there are urban Indigenous health organizations who are offering the vaccine. And there is some talk about demonstrating Indigenous roots, because we know we're prioritized in terms of getting vaccinated. So how each center or organization asks for proof or not regarding the genuineness of your ask. Some organizations are asking for status cards. Some are saying you do not need to present proof, and it's up to those individual organizations to administer as they feel. So I know there's a lot of talk about ingenuity, and I'm not even going to be able to say the word, oh my goodness, proving ingenuity. Does that sound right? No, that wasn't right. You know what I mean. Okay, so I just do want to give a shout out though to Wabano Health Services in Ottawa. They are offering vaccines to Indigenous people who are 55 plus. So if you do fall into that area, please give Wabano a call and get yourself on that list. In Toronto, Anishinaabe Health is offering vaccines as well. So I just wanted to share a little bit about that. Now, Leila, I mean, we line up for vaccinations so that we can go down south I know numerous people who go down to Cuba, Mexico, not this year, obviously, and we want to get twin ricks because we don't want our holidays ruined by anything. You get where I'm going. It's a lunchtime program for some people, so we won't get into the details of why you want twin ricks, but it's just another vaccine. And there's a long history with vaccines, right, Leila? Like, how should we be looking at this? Is this just another tool in our protection?
Absolutely. As I mentioned, I've given thousands of them over the years. And I think, just like many other vaccines where there's more than one dose, this is one that has 2 doses. And it's no different than, your children who go in for their 4-month and their 12-month and the various vaccines to get that booster effect over time. This is just another example of another vaccine. There's different technologies and methodologies in the development of those vaccines, but ultimately they are another vaccine. As I mentioned, hepatitis, twin ricks, as you mentioned, tetanus shots when you go in for your booster, when they asked, has it been 10 years? I think that it comes from the same family of scientists and people who have been developing these vaccines for generations. And so this is just another one that we're really lucky to have and to have had the international investment that helped it to move along so quickly. And so, I think that absolutely, it's totally a good analogy to say, it's not unlike any other vaccine that we're receiving now. And it's based on a lot of the exact same science. And of course, we're using a lot of the science of previous vaccines to help us to sort of move along with what is now one of the largest vaccine rollouts in the world, and it's certainly in Canadian history.
And I just got a note, and thank you to the FNHMA staff who are listening and watching to our own town hall. It's always good when the staff are watching. I just want to correct myself and say that Wabano actually is vaccinating adults 50 and older. So I know some staff who are on the FNHMA team who fall into that bracket. I'm not there yet myself. I'm just saying, just to make somebody else feel, on the FNHMA team a little bit older than I am. But there we have it, 50 plus. Leila, why are we prioritized? And I think this will help a little bit with some of the misinformation and to talk a little bit about we're not being experimented on. It's because of our populations being underserved for the most part. So do you want to tell us about why we are being prioritized?
Yeah, I can certainly give you my perspective on that. I'm sure that the National Advisory Committee on Immunization did the prioritization, but just like my 92-year-old mother is prioritized, it's for similar reasons, and it has to do with the degree of access to services in many respects, but also some of the history of chronic disease. You spoke about immunocompromised people. There is just a higher rate of certain chronic diseases within Indigenous populations, but also the location of Indigenous populations are often more remote and removed from healthcare services. And so the risk of hospitalization and really severe disease is greater for a vast majority of the First Nation population that live certainly in the north of Canada. And so, as Kelvin mentioned, all of the territories have been prioritized, and partially it's because of that, remoteness and access to other support services. But certainly within the vaccine sort of prioritization, ultimately it has to do with risk and sort of the degree of risk for individuals to acquire a vaccine, but also to get the complications that are associated with it.
I can't believe how fast our time goes by. We do have some time for a couple of more reflections. And Kelvin, I know you have a personal story to share around this. What would you like to share, Kelvin?
Yeah, so one of the things what I think about if folks are like nervous or worried about the vaccines, I think about my grandma. And so my grandma was born on the land in the Northwest Territories, and she became an orphan at age 5. And the reason she became an orphan was because both of her parents died from the flu. And this was in the early 1920s. And because she was an orphan, she got put in a residential school permanently. Like, she had no parents to take her home in the summers or during the holidays. And the flu has killed so many of our people. And if we could imagine a world where we could go back in time to then and help my grandma to not be an orphan, the stress, like how I feel about that is so strong. I think about these scenes in a similar way, where if there's an opportunity to take away a death with a vaccine, then it seems like the kind of thing that is really important to do. And back in the day, it was things like this that killed so many of our people. And there may be a risk, a very tiny one, if you think about the thousands and millions of people who've already had the vaccine, but the effect of saving lives is there. And so that's one of the reasons I want to get the vaccine, is just thinking about my grandma and her being an orphan because of the flu. And maybe folks listening have their own great-grandparents or grandparents that had a similar situation, and it would be great if we could avoid things like that again in the future.
All right. Well, Calvin, don't go away. I do have I have a minute, and I want to get in what your advice would be to those youth who are not convinced is canceled. How do we reduce their sadness and still encourage them to stay socially distanced? What are your thoughts? And we have about a minute, Calvin.
Yeah, for sure. So it's tough. It's so hard to let go of those things, and we can't undermine that. And when we think about it, we have to accept that this is so hard. But we can also think about it for ourselves. If we can't have this, then what will we do for ourselves instead? And to not think about it as just we're cutting something out of our life, but that we can't have this thing, so instead we'll do this other thing. And I think as families, as friends, we can think about it that way, and to fill that gap somehow else, so it doesn't feel like something is just disappearing. And so, okay, we can't have the hockey tournament, then we'll do this other thing that can bring joy, and we're still letting go of something, and we have to let go of it, but we can still take care of ourselves in a different direction to make up for that. And that's what I would probably recommend.
Thank you so much, Calvin. And hey, friends at NCI Radio, Garth specifically, who always asks me the tough questions every Thursday morning on NCI Radio. Thank you for sharing that PubMed lists several articles about COVID-19 reinfection and saying that it's exceedingly rare, but possible. And I see Leila, our health expert, is typing yes. So yes, it's possible, but exceedingly rare. And thank you, NCI Radio, once again for sharing that information. Now, I do want to say that I have to thank a couple of folks. So I'm sorry we didn't get to some of the questions that folks had, but you know the drill. Please share them. If you think of something, we can always ask the experts that we had on the panel today at another time. So send the questions to fnhme@ihtoday.ca. And I just want to thank Calvin, Leila, for sharing your wisdom, for sharing all of the public health advice that you have, for giving those epi stats, and for being a ray of light, positivity, and hopefulness. So if we're going to take something away from today, let's be hopeful for the spring that is coming and for some sort of normalcy, air quote, if we keep following public health guidelines today. So stay diligent, stay safe. And I do want to thank a whole bunch of folks quickly. NCI Radio, I thank you all the time. So thank you once again, the Heart of Manitoba, and Micmac Maliseet News in Nova Scotia, The Wolf 95.7 in Fredericton, Nation News in Montreal, Element FM in Toronto and Ottawa, Eagle Feather News in Saskatchewan. Hey, hey, Treaty 4. Also, Alberta Native News, CJWE in Calgary, CFWE in Edmonton, CKLB in Yellowstone, also Co-op Radio in Vancouver, APTN News. Thank you, thank you, thank you. Of course, to the FNHMA as well, and the Anishinaabe Nation. So you can also find rebroadcasts on a couple of those radio station partners. So check out your Indigenous radio station near you. And with that, I look forward to seeing you next week, where we will continue to share information here on the FNHMA Town Halls. Hi, hi.